morning, everybody. It's a real pleasure for me to present you something about knowledge of healthcare workers on triple elimination of vertical transmission of HIV, Hepatitis B, and Syphilis in Burkina Faso and Gambia. It's the TRIMOM project. Burkina Faso and Gambia are two countries of the West African region. The prevalence in pregnant women of these three infections remain very high: HIV, syphilis, and hepatitis B. But the more highest prevalence is for HBV, with prevalence around 6 or 8%. These three infections have risk of mother-to-child transmission and neonatal consequences. Despite this, screening and treatment coverage for these three infections are very insufficient among pregnant women, especially for HBV and syphilis. Healthcare workers are on the front line in implementing the triple elimination strategies proposed by the WHO to accelerate the control and the elimination of these three infections. This study aims to assess the level of knowledge of health workers concerning these three infections in two West African countries. We involve healthcare workers in maternal and child health services. It was a cross-sectional survey during 4 months, and knowledge score was built for each infection, exploring knowledge in 4 areas: transmission modes, screening, treatment of the mother, and consequences for the infant and care. We done linear regression to identify factors associated with a higher score of knowledge. The result: we involve 185 health workers, and the majority coming from Burkina Faso with 62.7%. Midwives were most represent group in the two countries with 64.6%, and the mean age was 44 years for Burkina Faso and 37 years for Gambia. Here we present the two countries. The first box plot concerning the knowledge score, and the last 3 one for the Gambia. The first one is for HIV, the second color for syphilis, and the blue for HBV. In both countries, we see that knowledge score was lowest for HBV, but highest for syphilis. Concerning the 4 areas of knowledge explored, the sub-score were highest for the transmission mode and lowest for the consequences and care for children for the 3 infections, and also lowest for mothers' treatment for HBV. Concerning factors associated with a higher score of knowledge, we see that age and the fact to be trained on syphilis or on HBV was positively associated with a higher knowledge score. This can bring a discussion. The integration of the fight against hepatitis B into the HIV program only began in Burkina Faso in 2022, thanks on the triple elimination program. This could explain why the knowledge of healthcare workers about hepatitis B is quite weak, hence the need of training. TRIMOM project aims to build capacity in PMTCT in 2 countries and provide integrated care for these 3 infections in Burkina Faso and Gambia. After this cross-sectional study to assess the level of knowledge of health workers, we organized their training. We also established during this study a triple elimination cohort in Burkina Faso and Gambia, and our preliminary results are presented at this conference, and we have a poster. You are invited to see this. So in this project, we have 3 parts: a cross-sectional study, a cohort study where we test and treat women in primary care. We also have some ancillary study with hepatitis G antigen correlated, and after we have a last part. So this project want to strengthen screening for the three infection and improve access to the measure to prevent mother-to-child transmission. We work on 8 maternal and child health services, 4 in Burkina Faso and 4 in Gambia. We reach 185 health workers. We hope to reach 17,000 pregnant women and to reach 2,200 babies born to positive mothers. Actually, the impact of this program in Burkina Faso, we train 117 health workers. We have 5 peer mediators in the field, and we also have some laboratories with capacity building. So, knowledge score was lowest for hepatitis B in 2 countries. Having received a training in syphilis, hepatitis B was positively associated with a higher knowledge score. Result highlight significant training needs in the field of PMTCT of hepatitis B, as well as in the management of the 3 infections in newborn. Thank you to the healthcare workers, and thank you to the partner. We are the project director at SESTIM in France. I'm the PI of Burkina Faso, and the PI of Gambia is Maud Lemoine. Thank you very much.